Hey guys, welcome to Giant Clinicals. Today we're starting a series where we're going to cover different systems from first aid. So the first system is going to be the endocrine system, and we're starting with the embryology of thyroid gland. So thyroid gland, the core concept or the biggest picture is that you need to know that thyroid is basically endodermal in nature. So it is derived from the endodermal floor of the primitive pharynx. So this is the primitive pharynx. This is where the endoderm is present, and then there is going to be diverticulum because of the endodermal proliferation. What it does is that it descends into the neck via the thyroglossal duct. So baseline of the tongue. So you can see the thyroid gland is here. It starts to descend, and it is connected to the base of the tongue with the help of thyroglossal duct. The duct normally disappears after the descent, as it has to, but sometimes it actually persists. When it persists, it leads to formation of thyroglossal duct cyst. So a patient would come up to you, and then there's going to be a midline neck mass. The very first thing that you're going to be asking the patient is to protrude their tongue, because the thyroid gland is connected to the base of tongue with the help of thyroglossal duct. So when the patient is going to protrude the tongue, the thyroglossal cyst would eventually move in the upward direction in the neck, and you can appreciate that it is and you can actually correlate with it that how it's connected to the tongue, and it is going to be thyroglossal duct cyst, and it can easily get infected, so it's important to remove it. Then sometimes what happens is that some of the thyroid tissue actually is present at the base of the tongue, that is called as the lingual thyroid tissue, which is also said to be the ectopic thyroid tissue. Some people get it removed, but the major problem is that in those patients, that was the only source of thyroid hormone. So if the thyroid gland is going to be removed, the lingual thyroid gland is going to be removed, the patient is going to be presenting with signs and symptoms of hypothyroidism. Okay, then there's going to be pyramidal lobe, which is a partial persistence of the duct. So if the duct is completely persisting, it is going to present as thyroglossal duct cyst. If it's going to be partially persisting, it is going to be presenting as pyramidal lobe. Okay, this is the basic embryological development. It forms as a diverticulum. It is endodermal in nature. It is going to migrate downward, and then eventually the final position would be anterior to the trachea, and it is connected to trachea with the help of pretracheal fascia. Okay, the remnant of thyroglossal duct in the tongue, as we've discussed, that thyroid gland was connected to the base of the tongue. So it is connected to a point which in future forms foramen cecum, which is present at the junction of anterior 2/3 and posterior 1/3, and it is very normal to have. There are two types of cell: follicular cells and parafollicular cells. Okay, so now you know that follicular cells are going to be endodermal in nature. They're going to be producing T3 and T4. Now, parafollicular cells initially were considered as a derivative of neuroendocrine cells. So now, according to recent researches, it is basically endodermal in nature. So ultimobranchial body, the fourth pharyngeal pouch, is the main source of parafollicular cells, and they produce calcitonin. These basically increase in the medullary thyroid carcinoma, which we will discuss on later. The key clinical patterns are going to be midline neck mass, which is going to move with the tongue. Then there is going to be base of tongue mass, leading to, if that is removed, which will lead to hypothyroidism, lingual thyroid. Calcitonin is being produced by C cells, which is the most important because it is an exam trap. That C cells origin initially, which is the old teaching trap, is the neural crest cells, but now it is going to be the fourth pharyngeal pouch. Now, NBME questions are going to be looking like this, that there's a midline neck mass, which is going to be moving with the tongue. If it's attached to the tongue, it is the thyroglossal duct. Then tongue base mass, if it is removed, leading to the hypothyroidism sign and symptoms, then they're going to be asking about the embryological origin of the thyroid hormone, which is going to be endoderm, and then follicular cells are formed from it, and calcitonin cell origin is the fourth pharyngeal pouch and not the neural crest cells. I hope this cleared your concepts, and if you like this, so do subscribe to my channel. Thank you.